Hi everyone, I'm Ray and this is Florence. We're both osteopaths at the Martivale Clinic. I'm sure some of you have had treatments from us in the past. Basically over the next couple of weeks we decided to put some videos up on our Facebook page about some of the most common conditions we see patients coming in with for a variety of different body parts. It's mostly going to include some easy exercises and stretches you can do at home to try and help with your symptoms. Today's video is going to be on the shoulder. Some of the most common conditions we see patients coming in with in the shoulder is subacromial impingement, commonly known as shoulder impingement syndrome. Also we do see some amount of frozen shoulders, but true frozen shoulders actually quite uncommon. And obviously we do see rotator cuff injuries as well, such as tears. So starting off, I'm just going to talk you through basically the anatomy and basically what a shoulder impingement is. So if you look at the shoulder complex here, you can see the collarbone. On the back we have the shoulder blade. These two bones meet into the point on the side, which you can just see the prominence just here, which is called the AC joint, which you can feel quite prominent under your fingertips. Underneath this structure we have two common tendons that get impinged. One is the supraspinatus tendon. Again, if we just kind of flow to the side, this dip here you see is the groove where the supraspinatus tendon sits in. It dips underneath the AC joint and attaches to the head of the humerus. So you can see, as you lift your arm out to the side, that tendon is going to get slightly pinched onto the AC joint as it elevates. So once we get around about 80 degrees upwards, that tendon is going to be slightly pinched. The other tendon is the long head of the bicep, which attaches obviously from the bicep, goes from the bicep all the way up and attaches underneath the AC joint as well. So these tendons commonly get impinged together. So now I've talked you through the anatomy of the shoulder and some of the common conditions we see for the shoulder. I'm just going to walk you through some of the easy stretches and exercises you can do at home to help relieve some of your symptoms. Okay, so if you've got quite a recent injury of the shoulder, or even if a couple of weeks after the injury it's still quite sore, it's quite inflamed, it's painful to move, the first thing we want to do is ice the shoulder. Okay, so when we're using ice on any part of the body, basically we need to cover the ice with either a tea towel or the area of a bit of clothing so we don't get a burn on the skin. When we have shoulder impingement, there's two areas I like to apply the ice to have the most effect. One is onto the front of the shoulder. So starting to the side of the shoulder and wrapping around in handprint form. So when I use the ice pack, I use an ice pack like this, which even when frozen, it allows you to bend around the structure. So on this area of the body, I can start it on the side of the shoulder and wrap that all the way around so it's covering the front of the shoulder as well. So we're making sure we cover the bicep tendon. Okay. The other area I like to apply the ice to the shoulder is onto the supraspinatus. Okay. So again, I can apply that onto the supraspinatus because the ice pack allows a bend even when frozen. I can wrap that around, slightly covering the front of the shoulder as well. Okay. When applying the ice, again, like I said, I spoke about wrapping the area so we don't get a burn. But when we're using it, we want to use it for a good 15 to 20 minutes. And this is so the ice, basically the cold, penetrates deep enough to have a good effect. When using the ice pack, if you're giving it 15 to 20 minutes on, you have to give it at least 15 to 20 minutes off to allow fresh blood and nutrition to go to the area. You can use the ice pack as many times as you want during the day, as long as you're using that process of 15 to 20 minutes on and the same period off, and then repeating that all the way through. As a realistic sort of expectation, 3 to 4 times a day is good, but as many times as you can. So again, this is still an exercise for the early stages when your shoulder's still quite acute. We don't want to be doing anything too aggressive and may risk inflaming the tendon further, okay? So what I'm going to get Florence to do is start off with some resisted active movements. So the movements we're going to start off with doing is abduction, internal rotation and external rotation. Again, at home, you can use the wall to push into or the window ledge if you're doing the internal rotation, okay? I'm going to use my arm against Florence just as a demonstration, okay? So initially, I'm going to have my arm just against Florence. Again, picture this is the wall. I'm going to get Florence to push outwards gently into my arm. Again, it's a very gentle pressure, so we don't want to be feeling the pain over the shoulder of this. If you're feeling the pain, ease off on the pressure slightly, okay? It should just be a slight tension over the shoulder here where the supraspinatus sits. We can hold this pressure somewhere between 15 and 30 seconds. If we get into the 15 and 20 seconds stage and it's starting to cause pain, stop, okay? Don't push it through to the 30 seconds and relax. So once you've done that for 15 to 30 seconds, rest for 30 seconds, repeat 1 or 2 more times depending on the pain level in your shoulder. If you're starting to get inflamed, don't push it, okay? The next exercise is external rotation, so we're going to bring an arm into that movement. Again, picture my arm is the wall, so what I'm going to do is get Florence to gently push her fist into my hand, keeping her elbow into her side. Again, holding slight pressure, 15 to 30 seconds, and relax. And again, we're going to have 30 seconds rest. If there's no pain in the shoulder, we're going to repeat one more time, and again, if there's no pain on this movement, we're going to rest for 30 seconds and potentially repeat 2 more times. Okay. The next exercise we're going to do is internal rotation, so it's going to bring the arm into the stomach. Again, I'm going to use my hand to demonstrate, but you can use a door frame, so the inside of the door frame to use the restriction there. Okay. So I'm going to pop my hand here. I get Florence to turn her arm inwards towards her belly, keeping that elbow into her side. Again, 15 to 30 seconds, and relax, okay? And same process, 30 seconds rest, and repeat 1 to 2 more times. Again, for the acute phase, what we're going to do is a quick exercise just to help the range of movement a little bit, and try and loosen up the muscles around the shoulder joint. So what Florence is going to do is just quickly demonstrate. I'm going to get her to stand side on slightly so you can see the movement a little bit clearer. What she's going to start off doing is literally bring the arms back and forwards, nice and slow, creating almost a little bit of a swinging motion through the shoulder. And what you almost want to do is nice and slow when you're doing this, but you want to almost let the muscles completely relax and almost just let the momentum of the arm take the movement, okay? To create a little bit of traction, what you can do is hold a water bottle into the hands or bag of sugar, something that adds a little bit of weight, so you get a little bit of traction into the shoulder while you're making the movements. And again, obviously it depends how acute your arm, how far you can take the range of movement. If you're very acute, you may just want to make a very small movement just to create a little bit of movement. As long as you haven't got any back pain, you haven't got any other issues, what you can do is also take this into a circular movement. So I'm just going to get Florence to lean against the counter to demonstrate. So again, we want the left leg forwards if you're leaning on the right arm, just to support back a little bit. Lean the body forwards so it opens up basically a space in front of the body to create the movement. And Florence is just going to take it into a gentle circular movements. You can do this in both directions. Again, you can use a little bit of weight into the hand to create that traction. But it's a nice way to get all the muscles around the shoulder relaxed, create a bit of traction through the shoulder, and it helps the shoulder increase the range of movement as well, very gently. So what we're going to do now is a stretch for the shoulder. So we're going to try and make this movement as passive as possible. So we're going to try and let the body weight do the movement and the arm just follow, okay? So this again is probably a little bit too aggressive for the acute phase, but a couple of weeks after, once the shoulder's not so acute, the muscles will relax a little bit, you've got a little bit more range of movement, we can start working into that range of movement and gradually increasing it. So Florence is just going to quickly demonstrate the exercise. So she's sitting in a chair, one arm onto the couch, we can use a desk, arm of the chair, something like that, and if you've got home accessible. She's going to start off slowly walking her fingers forwards. Once she gets to a stage where we've got a little bit of flexion coming through the shoulder, she's going to slowly flex forwards through the body and let the arm make the movement, okay? Obviously, once we get a little bit of a pinch into the shoulder, that's enough. We don't want to push through that, okay? And we're going to gradually come back again, letting the body do the movement more than anything. Again, if you've got a bit of a grippy surface, you can put a piece of paper underneath it, create a little bit more of a frictionless surface, and just let the arm glide a little bit easier. We repeat this around about 10-15 times, again, stopping before we get to the painful range of movement. So we're just taking to its limit, not pushing it through, okay? And back up and relax. We can also do this out to the side, so Florence takes her arms out to the side, and again, this time we can lean towards it sideways, again allowing that to come into abduction, again stopping before it gets to its limits. Okay, and again repeat that 10-15 times. Now I'm going to give you some slightly more advanced exercises. This is targeted at people that are no longer in the acute phase, but the shoulder's still a little bit achy, you're restricted in range of movement, but more than you had before, okay? So what we're going to use is some resistance bands. These come in different resistances. So starting with the yellow, which is quite light, which Florence is going to use. Working our way up to the red, it does go up to the purple and black, but I prefer to use them for leg exercises. I think this is good enough for these exercises we're going to use. So again, like I said, Florence is going to use the yellow. She's going to demonstrate how to attach this to the door handle. So she's going to do it with a double layer. So you can use the door handle, a radiator, a banister, anything that's static and it's quite strong, it's not going to give way. So you can either use it in a double fold, or you can use, if that's too strong, you can just tie one end onto the door handle, so then you've only got one fold of the band rather than the double. Okay, so she's basically stepped slightly away from the door, so then she's got a little bit more resistance on. What she's going to do is keep her elbow tight to her side, and we're going to bring this into external rotation. So basically we're going to bring her arm away from the body. Okay, so we do it nice and slow and controlled, keeping that elbow tucked into the side while we're doing this. Like I said, nice and slow. We're going to do 15 to 20 reps. After we've done this, 30 seconds rest, and repeat that 2 more times, okay? While you're doing the exercise, we don't want any pain in the shoulder. It should just feel like a tension onto the back of the shoulder, okay? And relax. And we go on to internal rotation. So Florence is just going to quickly turn over. She's going to step away from the door to again because she's further away, she wants to adjust the tension onto the band. This time, same thing, elbow tightly into the side of the body, and she's just going to bring her hand nice and slow and controlled in towards the body. Okay, good. Again, 15 to 20 times. Nice and slow and controlled. Shouldn't be any pain in the shoulder. Good, keep going, and relax. Again, 15, 20 times, 30 seconds rest, repeat 2 more times. If there's too much pain after the first set, ease off the tension for 1, but don't worry about doing the next 2 repetitions, next 2 sets, stop at that first one. Okay, so the last exercise in this position is going to be abduction. So Florence steps a little bit closer to adjust the tension again, elbow tightly into the side. We can do this 2 different positions with a bent elbow and a straight elbow. And what Florence is going to do here is basically keeping the arm at 90 degrees. She's just going to take it outwards into abduction. We're going to only go to about 30 to 40 degrees. And you can either hold it in the 40 degrees for 20 seconds or do repetitions at this stage, okay? So she's going to do repetitions of 15 to 20, depending on the pain she's feeling and the tension she's feeling. Okay, and rest. Okay, we're just going to demonstrate quickly the straight arm. So if you step a little bit closer to the band, straight arm down to the side, and again here, 30 to 40 degrees. Perfect. Nice and slow and controlled. When you're doing this, we want to hold the shoulders backwards, so we're taking them out of an impingement position. Good. And relax. And again, relax for 30 seconds, repeat 2 more times. So what we're going to do now is a quick active release exercise. So we're using a spiky ball. This is quite aggressive, so you can just use a tennis ball or a dog's toy, anything got sort of round and firm at home that's accessible, okay? So what we're going to do is obviously starting in a laying position. Florence has got her knees up, just keep her back nice and protected and flat onto the couch. She can either place the ball in position herself by reaching over. I'm just going to put it in position to demonstrate. So what I'm going to do is obviously bring the arm across the body, roll Florence towards me a little bit, and I can see the inside of the shoulder blade here. So we want to place the ball between the shoulder blade and the spine into that nice fleshy muscle there called the trapezius. And we're just going to roll Florence back over onto that ball slightly. I'm not putting too much pressure on because it is quite aggressive. So what Florence is going to do, she's going to hold her arm in this position, and what I'm going to get her to do is just cross her arm across her body. So what we're doing, that's it, perfect, just like that. And we're going to repeat that again 10-15 times. So basically what's happening is the muscle's actively stretching with pressure onto it. Okay, good. It helps release any trigger points that may be in the muscle. Depending on sort of the impingement of the shoulder, it depends the sort of range of movement you're going to bring into. So if the impingement is quite severe at the moment, again, we're just going to keep it in this sort of position here. If it's starting to get into a bit more of a chronic phase, you can bring it slightly higher. If you're towards the end phase of the sort of impingement, it's starting to release up quite nicely now, you can take it a little bit higher and really start to get that high trapezius. Once you start bringing the stretch higher up, I would adjust the ball slightly higher, so we're getting a little bit more to the upper area of the scapula. So you're adding in the rhomboid muscles as well as the trapezius now as well. So you're getting an extra muscle into the stretch. That's it, good. And relax. As well as into the rhomboids and the trapezius muscle, you can also get the infraspinatus. So you can place this onto the back of the shoulder blade. So this slightly, you see you got the inside of the shoulder blade here, where the trapezius and the rhomboids are. We're going to put this actually directly over this big fleshy muscle onto the back of the scapula, on the back of the shoulder blade. And again, just applying a little bit of pressure onto the couch. And what Florence can do here, she can either make internal or external rotation movements, or she can make the same movement with a straight arm, just bring that across the body, applying a little bit of pressure while you're doing this. This exercise, you can also stand while you're doing this. You can actually place the ball behind the shoulder blade and push pressure back against the wall while you're doing it. Get a nice active movement that way. But like I said, it is quite aggressive. So 10-15 times each position. Use a tennis ball if you find spiking the ball too much. Okay, so just a few tips if you are suffering with a shoulder impingement or shoulder injury. Just a few common questions that we do get asked as well. So a lot of people struggle sleeping. They're trying to find a correct sleeping position that's going to help them get comfortable at night. A lot of people wake up with the pain, especially if you're a side sleeper. People are not too sure if to lay on that side or lay on your good side. It really does vary from person to person. I have quite a few patients come in where they actually feel quite comfortable laying on the bad shoulder because it's giving the shoulder support, but equally we have quite a few patients come in, it's too painful to lay on that shoulder, but when they lay on their good shoulder, because their bad shoulder is unsupported, it feels unstable and it's waking them up during the night with the muscles going into contraction. So a little tip, what you can do is get a pillow. A pillow that you sleep with is actually better than this one. It's quite useful. Place it in front of you, wrap your arm over it, just so you're supporting that arm. That gives the muscles in the shoulder a chance to relax. They don't go into spasm, they don't contract. It should just feel a little bit more supported for you while you're sleeping. Okay, but the main thing I can't emphasise enough, especially when you're in an acute phase, but all the way through the process really, is icing the shoulder regularly. We have to get the inflammation in the tendons down, like I said, especially in the acute phase. But once we start progressing with the exercises and they get more and more advanced, each time you've done the set of exercises, ice afterwards just to prevent that flare up from happening. As I said, in the acute phase, the main thing as well is to avoid that impingement site. So really anything above the 80 degrees, we're getting into the range where we're going to start impinging them tendons. So again, flexion and abduction is the main areas. So try and keep your range of movement in this area here. Once you're out of the acute phase and you're starting to work into the range of movement, it's the repetitive movements we don't want to do. So if you're repeatedly taking it into them sort of abducted and flexion movements, they're going to be impinging the tendons. That is going to create more and more inflammation. But when we're doing the exercises, we do need to stretch and try and work into the range of movement in a controlled fashion, in a way that's not repeatedly doing it all the way through the day. It's going to irritate it. Okay. Well, thank you very much, guys, for watching our video. We will be putting more up in the next couple of days, so keep tuned for that. Any questions you have, please drop us a message on Facebook and we'll try and answer them as soon as possible. But thanks again, take care.